Welcome. Today's presentation is knowing the difference between the Flexible Spending Account, or FSA, and the Healthcare Savings Account, or HSA. Before we talk about the differences, you need to know exactly what an FSA and an HSA is, right? We have two FSAs, the Dependent Care Reimbursement Account, or DCRA, which can be used to pay for child and/or adult daycare services for your eligible dependents, and the Healthcare Flexible Spending Account, or FSA, which allows you to set aside pre-tax money for qualified medical expenses. The Health Savings Account also allows eligible members to set aside money on a pre-tax basis for qualified medical expenses not covered by their health plan. Both FSA and HSA have similar benefits, but they have different eligibility requirements, contribution limits, and other features. For today's presentation, we will be concentrating on the Healthcare Flexible Spending Account, or the FSA. The beauty of an FSA is that it is a type of savings account that allows individuals to save money tax-free. You are not required to be enrolled in a health plan to participate. The FSA is pre-funded, which means that you can use the funds up to your annual election on the first day of the new year or at any time during the year while employed. Your withdrawals are tax-free for qualified medical expenses. The FSA does not build over time, so it is not a long-term savings tool. You can pay for many expenses on the spot or on the go with your healthcare debit card or pay using your mobile app from Health Equity. You can elect the FSA managed by Health Equity even if you enroll in the POS plan and do not participate in any health coverage, or you don't meet the eligibility requirements to be enrolled in a health savings account. As you can see from this list, which is not an all-inclusive listing, eligible expenses for the FSA could be for hospital services and fees, eyeglasses, therapy, co-insurance or co-pays, and much more. Things to remember with an FSA is that some expenses may require a prescription or other documentation from your physician. IRS regulations require that 100% of your card transactions be verified to show services rendered and/or items that are eligible expenses. The plan year ends on December 31st. Claims incurred from January 1st to December 31st of the previous year must be received by March 31st, only if you re-elect into the FSA for the upcoming plan year. It is important to remember that due to termination or changing elected coverage for the FSA can only be done if you experience a mid-year qualified life event, which we call a QLE. An active minimum $10 per pay election is required to keep your account open. Any unused funds up to the maximum of $610 can roll over into the next plan year only if you re-elect the FSA during open enrollment. If you stop your plan due to leaving employment, you will have 90 days to request reimbursement of remaining funds for services received prior to your termination. And lastly, FSAs are not portable and therefore cannot follow you to your new employer, and any unused funds may be forfeited. With the FSA, there are no employer contribution provided. So now you know about the FSA, let's jump right into the HSA. What is a health savings account, or an HSA? An HSA is a type of tax-advantaged savings account. An HSA allows eligible members to set aside money on a pre-tax basis to pay for qualified medical expenses not covered by their health plan. An HSA offers flexibility to allow you to save money long term since whatever you don't use in any given year will roll over and accumulate as savings over time. The employer contributions made are tax-free as well. Interest and investments are also tax-free. Once your account's balance reaches $2,000, you can elect to invest in mutual funds. Members must meet the eligibility requirements to enroll in and contribute to an HSA. You must be enrolled in the Consumer Driven Health Plan, or CDHP, to qualify for the HSA. Employees must not have any other health coverage. If your spouse or dependents have other coverage, you remain eligible for the HSA if you meet all other eligibility requirements. If you have or had an FSA, flexible spending account, prior to enrolling into the HSA, all funds from the FSA should be spent before enrolling in the HSA. And lastly, you, the subscriber, cannot be claimed as a dependent on any other person's tax return. When electing the HSA, you may be eligible to receive an employer contribution that is prorated throughout the calendar year to those that meet the eligibility requirements and elect the health savings account. For school employees, they are prorated semi-monthly for 20 pay periods. For city employees, they are prorated bi-weekly for 26 pay periods. For subscriber only, the employer amount is $750. All other tiers receive $1,250. For terminations or change in elected coverage, there are no restrictions for mid-year election changes for employees enrolled in a qualified HSA-compatible plan. Employees may stop, decrease, newly elect, or increase their contributions throughout the plan year. Please take note, Health Equity may charge a monthly administration fee, and their fees varies, to cover the cost of maintaining your inactive account. An account closure fee of up to $25 may apply. If you leave the employment of Virginia Beach City Public Schools or City of Virginia Beach, your account belongs to the individual and never forfeits even after you leave employment. The next section, we will concentrate on the differences between the FSA and the HSA. This chart shows the difference between the FSA and the HSA. For the FSA, employees do not have to be enrolled in a health plan to participate. FSA funds are pre-funded. However, funds expire at the end of each year. The unused funds can be carried over only if you re-elect the FSA for the following year. And if you leave employment or are no longer eligible for the FSA, you have 90 days to request reimbursement for remaining funds as long as the eligible expense was incurred prior to your plan ending. The Health Savings Account. You must be enrolled in the CDHP plan, which is a high-deductible health plan. The employee cannot be enrolled in any other health plan. It offers prorated employer contribution for those that the eligibility requirements are met. The HSA belongs to the individual and funds will roll over each year and never forfeit even after leaving employment. The HSA does have fees that are applied monthly and for account closure. All accumulated savings can be withdrawn tax-free after reaching age 65. Only you can determine which plan fits you and your family's needs. To assist you in seeing how the FSA and the HSA can best fit your needs, we will review a couple of scenarios. Meet Aspen. He visited his PCP to determine if a specialist was needed. He also used the Centera treatment cost calculator to shop around for a sequin provider with the lowest cost. Aspen meets the eligibility rules for the health savings account. Scenario 1 shows side-by-side comparison for both the POS and the CDHP. Both plans offer 100% coverage for preventative care. For the POS plan, the costs are actual charges. However, for the CDHP plan, assumptions have been made for the specialist visit and the generic medications. For this example, after calculating the annual premiums, the CDHP plan with the HSA is the best plan for Aspen. Meet Morgan and Aiden. They are enrolled in coverage. Both are healthy and use the preventative care services. Morgan visited her PCP after confirmation of pregnancy. She joined the Partners in Pregnancy program that's offered through our Be Well program. Scenario 2 shows both plans again side by side. With this scenario, it confirms that Morgan and Aiden made the right decision to have enrolled in the POS plan after they were calculating the upcoming charges and premiums for this pregnancy. The POS plan would have less out-of-pocket costs for both of them. With the POS, the total annual cost would be $8,869.28, while the CDHP total cost would be $9,009.64. I hope these scenarios can help you decide which plan fits you and your covered dependents' needs. Should you need to contact the Consolidated Benefits Office and/or Health Equity, we wanted to provide you with the contact information. On your screen, you can see the Consolidated Benefits Office contact information as well as Health Equity. Remember, we are here to assist you in all your benefits needs. We are only a phone call or a click away. This concludes our presentation. Thank you for your time and attention.